It keeps changing like a chameleon.
Now with strains like Alpha, Beta, Gamma, Zeta, and Delta. All these are different from the wild type that started from Wuhan in 2019. They have all been confirmed in Lagos. The Nigeria Center for Disease Control raised alarm over the detection of confirmed case of the SARS-CoV-2 Delta variant, also known as lineage B.1.617.2, on July 8th. The Delta variant is a highly transmissible variant of COVID-19 originating from India. It affects people more rapidly than the other known COVID-19 variants. It does not spare the younger population, spreads faster, and kills quicker. On 11th of July, Governor Babajide Sanwo-Olu said the third wave is in Lagos, the epicenter of the pandemic in Nigeria. The incident commander is worried about the increasing number of patients at the isolation center. At the Yaba Infectious Disease Hospital, which is the nerve center and headquarters of the Lagos State COVID-19 Incident Command Structure and Response, the environment looks so quiet. But the emergency unit is not empty. The wards are also busy. With the Commissioner for Health, my first question is, when will this end?
Before a pandemic finally moves out of circulation, is that it goes through a number of waves, usually between 3 and 5 waves. It's natural for pandemics until the entire population is either immune because of infection, or immune because of vaccination, or immune because of both. It's impossible to predict what the third wave is going to be like. It may be smaller, it may be the same size, or it may be bigger. That's in quantity. It may be more severe, it may be less severe. That's in quality.
Professor Abayomi said it is not unexpected to see some of the variants in Lagos, being a cosmopolitan city where people are trading and visiting different countries. But there are measures in place.
There is Brazil, India, Turkey, and South Africa. If you're coming in from the red countries, you are not supposed to go straight home or into community. So we mandatorily keep you in a facility. We test you on day 2 and day 7. If you are clear on day 7, you are free to go home and go out. So that way we have really prevented people from coming in from these high burden countries from affecting Lagos.
The biobank is filled with new test kits waiting to be distributed across the state in case of surge. The test positivity rate already going from 1.1% at the end of June 2021 to its current rate of 6.6%.
These are all ultra-low freezers used for storing samples. They are all loaded with positive samples of COVID-19.
They contain samples from 2019, 2020, and 2021, including the fresh third wave.
With mutation, it means the virus presentation, the effect it has on the body is now different. And occasionally, some of them will even evade detection by the normal mechanism that we have. And that is why we have been able, the Mr. Governor has been able to provide for us even capacity to detect variants through enhanced detection kits up to the level of sequencing. We have more than 15,000 test kits to be able to extract and do PCR and be able to detect the various types that we have in Lagos State.
We've got the variants from the UK, the variants from South Africa. We have the one from Brazil. We have another clade from Thailand. And then we have the Indian strain.
The occupancy rate at the isolation centers has increased from an average of 1% to 6% in the past weeks. The third wave is no doubt gaining momentum. At the IDH, there are 13 occupants at the single-room wards, 2 at the ICU, critically ill. At this general ward isolation 1, 5 patients are receiving treatment. all from the third wave of COVID-19 with different strains.
All the patients on admission currently are on oxygen, and they are not just on oxygen, they are on very high flow oxygen. The ones with very severe cases of COVID, the ones in the world who need high flow oxygen are people that we have observed to not to have taken any of the vaccine, either first dose or second dose. Of course, I would say that this is just an observation. Basically, we have an oxygen plant in the hospital that generates about 60 cylinders per day. In the last few days, when we started having COVID patients, we discovered that our rate of oxygen consumption has actually increased from about 50 to about 70 to 80 per day.
For now, Lagos State have vaccinated 331,000 people with the AstraZeneca vaccine with the first dose, and 243,000 have got their second dose. But many are wondering why some people would get 2 jabs of the vaccine and still get hit by COVID-19.
What we have said is that the vaccine will boost your immune system and will help you to fight the virus, which can result in 2 things. It can either result in you not catching the virus if you encounter it, or it will result in you having a milder infection if you do contract it. The end point really is to stop people from dying.
What we have seen so far is that those who have taken the vaccine, either the first dose or the second dose, actually have very mild form of the disease, and none of them so far has required to be admitted into the hospital and then be given high flow oxygen.
The Lagos State government is not sitting idle. It says now passengers who do not provide the right details, including a phone number they can be reached for monitoring and an address for isolation, will face serious sanctions, including fines and imprisonment. That's according to the Lagos State Coronavirus Law of 2021. Governor Sanwo-Olu had also met with the Nigeria Immigration Service and charged them to tighten the borders.
You are the gatekeeper. You are the goalpost that can work with our frontline health workers and our port health authority workers to ensure that people that are coming in, obey our rules, conform with our COVID protocols, and nobody is above the law.
The government is reiterating full compliance with all protective protocols as social distancing, temperature checks, hand washing and sanitizing, and a maximum of 50% occupancy in enclosed spaces and for religious activities are now mandatory. The first wave of COVID-19 between February 2020 to August 2020 was deadly. The second wave between December 2020 to March 2021 was nasty. Now the third wave, starting from July 2021, stands unpredictable. The short normalcy period enjoyed as the deadly second wave wind down at the end of March 2021 is over. It is high time everyone picked up their face masks again. Adedoja Salam Adeniyi, TVC News, Lagos.